So we are starting with the discussion of solution focused therapy or solution focused approach while we use in counseling. Okay, so before I start, I would like to know from you guys, what do you understand or what is your understanding of solution focused approach?
Hello, ma'am.
Hi,
Can I
and
start?
yes, please go ahead.
So it is a future oriented therapy. It
Okay.
focuses on the solutions and not on the
Hmm.
problems.
Hmm. Right.
Right
Great.
now, that is all
Okay.
I can recall.
Okay. No issues. Anything else anyone would like to talk about when you say solution focused approach? It's okay if it's wrong, but at least something. Okay, so
Hi.
when you, yeah, yes, Yuktika.
Yeah. So, in solution focused approach, we try to do two things. Firstly, we try to understand what are some areas that are causing them significant distress. We try to rate them down and then focus on the topics or the goals that are mostly affecting them. And then we move on to other areas. We try to find out solutions that has worked in the past for them by asking exception questions and then trying to see whether in other areas of the life it can be used. We use miracle question to sort of understand if overnight if things could change, what are some things that they can actively do in their lives to sort of achieve what they want to do, to get their mindset from like more goal oriented, more action oriented.
Right. So both Anjali and Yuktika actually correctly talked about solution focus approach. Okay. Now, solution focus approach in itself is very extensive, but this discussion will majorly focus on what exactly it is and in what all sessions and situations you can actually use solution focus approach. Okay, techniques are different. Techniques are certain technical things. Obviously, in 1 hour we cannot discuss all the techniques, right? But we would be focusing on where and how of that therapy, right? Any one of you who have earlier used solution focus approach? Yuktika, you have? So,
Yes,
and
ma'am, I
Anjali, I
have.
think you also have, right? So, if you
Yes.
both would like to discuss what form of case it was, like, uh,
Can I go ahead?
okay, Anjali, and then Yuktika, okay?
So, so in one of my pro bono counseling cases, the client was having workplace issues.
Hmm.
So according to me, what therapy I chose was SFPT, and it worked well with the client with miracle questions, pre-therapy change, and exception questions, and yes,
Okay,
scaling questions as well.
okay, great. Yuktika?
I usually do use solution focus when the client seems to have a lot of different concerns. Like it can be relationship issues with friends or partner, it can be work related issues. When there are a lot of things to get focused to some concerns, but a lot of times I do use it with depression when the client feels very hopeless that there's nothing I can do.
Hmm. So, see, when you talk about solution focused approach, it is basically an approach which is a supportive therapy. So, when you talk about mainstream therapy, CBT, DBT, EFT, uh, REBT, psychoanalysis, all these come as a mainstream therapies, okay, which directly work on the disorders. But when you talk about solution focused approach, that is a support therapy. That means it has to be done in addition to the other therapies. Okay. I personally obviously use them with the issues which are in like which are during the insight. So that hasn't created a level of abnormality or dysfunctionality. Okay. But for the sessions where like Yuktika and Anjali was talking about more of things that needs problem solving. I would define it like that. Other than that, it is also useful for your relationship counseling, your family counseling. Okay, in premarital counseling, approximately we use, and postmarital in relationship, pre-post, both, even live-in counseling sessions, you can use solution focus approach. Okay, and just to give you a small example that, okay, so when you talk about solution focus approach, I'm not sure if you know, it is actually an output of family therapy. So when family therapy things were happening, then only in that only solution focus approach came out. That is the reason why it is more used with relationship counseling and family counseling. Majorly in group counselings also you can use solution focus approach. I think Yuktika has already talked about different, and even Anjali has talked about different techniques like medical questions, exception questions. You can also talk about the medical हो गया, exception हो गया, scaling technique हो गया. All these techniques are there. Yes, Anjali, you would like to add something?
So the other one would be formula first session task
Hmm.
and therapist feedback to clients.
Yes, there's also a bridge task that is I think you can very similarly give it to first formula technique only. There's a bridge, like bridges when you are giving a homework to the client. It's called as bridge technique. Okay. So basically, in all these areas, you can use solution focus approach. And when you talk about solution focus approach, you have to understand that not only as a therapy, but when you're starting your sessions, it can be helpful in rapport formation and goal formation. And even when you are taking the regular initial checkouts of your sessions, you can use anyone who knows about SFT and techniques, anyone who can think that how SFT can be used for goal formulation of your session. So, okay, except for Yutika and Anjali, how many of you know about the techniques of SFT? Let us first talk about that. Nisha, Piali, Sarvat, Aisha, Vishal, Kajal, Simran, Arjun, Donovan. Do you know about the techniques of SFT? Simran knows. Okay. Rest. Okay. 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 So basically, no. Okay, so basically, I will just summarize these techniques. Okay, so when you talk about solution focused approach, the first thing is miracle question. That what, so miracle question is where you ask the client, okay, what would, so if something happens that change your life completely, what would be that thing? Okay, so that is a form of miracle that would happen in your life, and suddenly everything in your life would change. So, what miracle it would be? So that is something which is there. Then we have exception questions. Exception questions means the things or the times when the problem was not this serious. That is exception questions. Okay, where we do them. Okay, what was the difference between the times when this situation? So let's suppose if a partner, if let's suppose for couple therapy, a partner has, both partners have come and they're saying, okay, we fight a lot. But exception question would focus on the times when you are not fighting that much. What was the difference between that time and the time today? Okay, so this is basically the exception questions that we basically use in your SFBT. Okay, miracle question can be changed with children according to the ages also. Like we use the वो होता ना, fortune telling ball देखिए, it is like a ball, like ऐसे ball में देख के वो future बताता है. तो usually with children we use this technique. Okay, if this is your fortune ball, how do you see yourself after 10 years? So वो fortune में draw करके देते हैं. So it helps the children to be more creative. Plus through drawing you can also access the projective technique. You can also use shaka baka laka boom boom pencil example. So if you have a magical pencil and you can draw your future, what your future would be. So according to the ages, this medical questions can be molded. Okay? And then there's a scaling technique. Scaling technique asks you to rate the problem. And this will help you to understand to what extent the problem has been resolved or need to be resolved. Okay, that is scaling. Then we also have formula first session as Anjali, right? Like uh, what should be the next, like what should be the so it is basically a form of homework only that you give after your first session, and you just want your client to observe the things, that what is the intensity of the problem and all those things. Okay, that is first formula uh, task. Then we give therapist, which is a bridge technique. Okay, we complement, we bridge, and then we suggest. So I will tell you. And there's also coping questions. Coping questions means, so let's suppose today the client came to me saying that, okay, I have a lot of problems in my relationship. But if you were having the relationship problem since so long, then what was helping you to cope? That is coping question. Okay, that help you to understand the resources. So this basically help you to understand that how solution focus has also branched in positive psychology. Then there's clarification, and there's normalization also, where you do not decrease the importance of the problem that your client is having, but you try to tell them that, okay, this is something which is usual. So let's suppose there's a mother who is a mother of an adolescent comes to you and says, okay, my child is not spending time with me. Now this is something that you will observe in your adolescent here and now, like every day. So you might not want to say, okay, I know this is happening with everyone. You might just say that I know it might be difficult for you seeing your daughter not spending time with you, but I think this is a stage where she would also like to explore her peers. She would like to explore new opportunities, and this is stage which comes to everyone's life. So I told her also, I empathize also, and I told her also why this stage might be there, so that there is no guilt feeling in the patient also. That is normalization also. And then there is experiments and homework, where we ask the client that what could be the homework for the next session. So here you do not directly serve homework to your client, but you ask them. So these are the techniques I have briefed. I'm not sure how fast I was and how could you catch. But now, taking these techniques into the consideration, how do you think these techniques, or which technique can be helpful in rapport construction? Okay, so rapport, I'm not talking about. Yes, Donovan.
Ma'am, I think exception questions and maybe coping questions.
Will it help in rapport formation or goal formation?
Rapport, I think.
Okay, coping and exception questions. Okay. Uh, Anyone else? Yes,
Can
and
it be pre-therapy change?
the
For
therapy change. Okay, would you like to summarize the technique for those who don't know the technique? Because there are many and I haven't talked about pre-therapy technique. Just summarize, not in detail, but one or two lines, that's it.
so in pre-therapy technique, the it is common for solution-focused therapists to ask, what have you done since you called for the appointment that has made a difference in your problem? So the therapist will ask the client this way, that what have you done since you called for the appointment that has made a difference in your problem? By asking about such changes, the therapist can like evoke a response from the client's part, that to bring awareness, to make a positive change.
Right. So basically, it is a technique where the therapist is trying to explore what has already been tried. So basically, when you talk about solution focused approach, when as a SFT therapist, I'm trying to apply this with my client, my aim is that I will motivate my client to do something that is working well already for them. So let's suppose my client said, okay. So let's suppose this client of that adolescent mother has come to you and she said, okay, so that she spends time with me, I have started sitting with her, seeing the programs she likes. And I feel that that has helped because I'm trying to communicate, I'm trying to have a same plate or balance where both are communicating. So that is something will be pre-therapy task. That what you have already done. So as a therapist, when I'm saying, okay, this is working, I would motivate my client further to use the same technique also. Is it making sense? Okay. Anything else which you can use for your rapport formation? Okay. Guys, you have to be interactive, okay? वरना ये lecture बन के रह जाएगा discussion की जगह. सीधी सी बात है. ठीक है. So basically, when you talk about rapport formation, you will see that it is a continuous process. At any stage, you cannot say, I know everything about my client. Client is, if you are smart, client is smarter. Okay, they know what to reveal, what not to reveal. So through questions like magical questions, exceptional questions, and coping questions, these three questions can be used for constructing rapport better. By when I say rapport, it doesn't mean so I am referring therapeutic alliance as rapport here. Rapport is just a part of therapeutic alliance. So therapeutic alliance means the complete relationship. Therapeutic alliance, alliance that has been made for the therapy purpose, right? So when you use this, you will try to understand the client better about what capabilities they're already working in. So when I already ask my client that, okay, what all techniques you have used, I would know that this is the level of insight my client is already having, because of which they are able to think that this could be the solution. Okay, is this clear? Any questions you have regarding SFBT? Donovan, you had a question, but muted.
No, ma'am, no question, no question.
No questions regarding SFBT. Okay. How will you use SFBT for goal formation? Which part can be used for goal formation? Yes, Anjali.
Can miracle questions be used for goal formation?
Yes, medical questions can be used for goal formation. And what can be used for mood check and progress check?
Sorry, ma'am?
Mood check and progress check. So after in every class session, when you start the session, you try to understand, you know, to what extent the client has improved, what extent they have worked upon. So which technique you can use for mood check and progress check?
Formula for session task? Can that be used?
Scaling questions. Simran mentioned scaling tech question. Formula first task is homework.
Okay.
Okay. So, Simran, would you like to give an example? How would you do that with scaling?
With scaling, it can also be something like on a scale of 0 to 10, with 10 representing, let's say, a desired outcome, and 0 representing the opposite, where would you say you are today?
Hmm. Right. So basically, I want to, let's suppose I have this client who is working on relationships only. Okay, and I'm using SFBT with this client. And this client says, okay, goal of my therapy is that I want a marriage where the communication is good. Okay. Now, in relationship counseling, or when you talk about premarital counseling or couple counseling, what happens is that this scaling technique also help you to form a goal to which both the partners agree. So let's suppose one of the partners says that okay, communication is a problem in our relationship. Now you want to know whether communication is problem for both or not. So to both individually, you ask this question that on the scale of 10, rate your communication where 10 is the best communication a couple would have and 0 is the least. To what extent or on what number do you feel your uh, you as couple are communicating right now, right? So that is very important. Similarly, you will write the progress also. So let's suppose in the last session when we meet, so if you would like to rate your anxiety that you were having last week, okay, that is before this session. This would be done at the end of the session, okay. Before this session, how much rating you will give to that level of anxiety, and after the session, ask it again that okay, now when we have a 1 hour of session and we discuss the issues that you're facing, now if you have to rate the anxiety on the same scale, what level you will give. Okay. You can also use it like, so when you join the therapy session, if you have to rate your anxiety level at that time, what would have been your anxiety level, and after having so many sessions, what is your level today? So that would help you. So my goal is that even if let's suppose my client say my at that time my anxiety was 10, and today I'm not saying 9, but okay, it's also not 10, it is somewhere between 9 and 10. So that also helped me as a therapist and my client to know that it's yes, it's working. And when I know yes, it's working, I would be motivated more to work towards it. So for on the part of client, it works very well. Is this clear? Okay. So I was yes, Mehzabeen. Yes, Mehzabeen.
Mom, I have a doubt that what if just the client says just for the sake of saying it that you know what, it's better because they're scared of sharing their anxiety levels.
See, Mehzabeen, if this part is there, then I think, see, that is the limitation of the complete therapy as a whole. Because we are at the end involving humans, and the basic postulate of therapy is that you have to be truthful to yourself and to your client. So on that part, you cannot actually do anything. Just like,
Okay.
what if the client says no, there's no change, even if you feel that there has been changes in the client? That can also happen, but that cannot be overcome because that is an individual factor. The only solution to this, where many a times people do other do, how would we know that they are faking or they are lying? But the truth is, as a therapist, when you will start constructing a therapeutic relationship, when we start our career, usually we are anxious of it, that what if my client is telling a lie to me? But as you practice and you learn that okay, this is how the therapeutic relationship look like, or this is how my sessions would look like, once my client has started trusting me, this fear would go automatically. Okay.
Okay.
Any other question in the process of SFBT, or the technique, or where to use, how to use, what all disorders you can use? It can be used because I've already told you it is for progress check, it is for homework, it is for rapport formation. It can be used with every disorder. If your client is at a particular insight where they can think of solutions, you can use there also. It can be used with couple counseling also, and individual counseling also, and group therapy also. Any question from your side particularly? Because I was planning of having a role play where maybe I demonstrate solution focus approach, so that you guys can understand. If still there's a question, we can uh, see that, like ask, you can. Psychotic disorders, no. Aisha, solution focus cannot be used with psychotic disorders because there's lack of insight and reality touch with them. Na? So if they are not insightful, they are not into touch of reality, how you can't expect them to be giving you solutions also.
Ma'am, you said it's like a problem solving technique. So when we talk about stress management and problem solving coping technique, can we mention this, or like it's a separate, being a total like a kind of therapy? Like
So you
solutions
want
are,
to say that while taking stress management technique, can I include SFT techniques?
yeah, yeah.
Yes. So as I mentioned, it's a support technique. It is support therapy. It can be used with anything.
Okay, ma'am.
Even when you take training sessions, you can use these techniques. Yes, Donova.
Ma'am, can this technique be used if the client is not very motivated or depressed?
No.
No.
Okay.
Okay.
So there are cases where the client is reluctant. So there are two things:
Huh.
resistant and reluctant. Reluctant में क्या आएगा? The client is not coming to the session. Resistant is they are coming but they are not talking about it. ठीक है? अब
Okay.
reluctant client को let's suppose the family pushes and forces and they eventually take the session. वहां पे भी they won't give you any solution because according to them problem is not there. एक मिनट हाँ. हाँ. So according to the reluctant client, problem is not there. So how they would
Mhm.
come? How would they give the solution to you? Like I remember there was an alcoholic client I had, and I asked him that don't you think it's a problem? So he said liver मेरा damage हो रहा है आपका क्या जा रहा है? So so in these cases any focal approach won't work. Yes, Arjun.
No, no, we can't hear you. Ma'am, and you were saying reluctant is one thing. What about resistant?
So resistant is they are coming for the session, but they are not able to give you all the information. So there's still an unconscious block. So that through probing of what is the solution to this? So probing would be okay. So let's suppose you are saying XYZ. Now to XYZ, what is the solution according to you?
Hmm.
You can probe and try if they are able to. They won't identify exact solution, but they would actually take you to the path where you can identify the solution.
Am I audible now?
Yes, Arjun.
Yeah. So I wanted to ask in addendum to what I think Gaurav was saying, bridging of that itself. SFPT or SFT as a technique is more functional in the instance where there is a willingness for inculcation of change to occur. Is that what I am referring to? Is it along those lines? Where the individual does have insight of the predicaments and wants to actively work on them rather than starting from a very trivial space.
Yes, see, that is true. That is the best and the you can say the most wanting type of client I would like to have in my therapy sessions who are willing to work. Okay, who are actively motivated to work upon it. But the issue is that this is not always the case. And in solution focused therapy, we start with first identifying the type of client I have and accordingly we apply. So when you talk about solution focused therapy, as a solution focused therapist, I won't immediately start applying SFBT on my clients as and when they come. I would first be identifying the type of client uh, I am having, and I am not labeling, I am not letting my client know that, okay, you are this type of client, but it is just for uh, uh, my knowledge that what form of technique and from where I have to start. So, in SFBT, we have visitors, we have complainants, and we have customers. This you can very easily, link it or correlate with when you go for shopping with your wives and your mothers. Okay, so the visitor, like when you go, when you're not very involved in the process of housing, you have a complaint. Okay, कि ठीक है, ये नहीं है, वो नहीं है, वो नहीं है. So you are there just to uh, uh, you are just there to complain. You are not doing anything for the solution. So you are not going to the market instead of your mother and buying it. So these are complainants. So they would tell you the picture of what is a problem. They would only be problem focused. Then there's a type of client who are in the complaint also and in the solution also. So you are a person who's telling the mother, okay, this is not there, and I will go and buy it. So this is a visitor. This is the best form of client you will ever get. And there is some sorry, this is a the customer. You are there, you are doing everything. Visitor is उसे किसी चीज से प्रॉब्लम नहीं है, मतलब उसे ना प्रॉब्लम से प्रॉब्लम है ना उसे सॉल्यूशन चाहिए. So everything at home is going on. I don't know, होगा नहीं होगा पता नहीं. So these are visitors. So this पता नहीं वाले clients are you cannot work with solution focus because they are not interested in problem. They are not interested in solution. Complainant के साथ क्या होता है? It takes time to make complainant a visitor where I can use SFBT with them to find the solutions.
Makes sense. Makes sense. Thank you.
Okay.
Ma'am, are
Yes.
there any techniques that we can use to change them into complainers to customers, from complainers to consumers?
You have to be patient with them.
Only patience.
And that therapeutic alliance that you form is very important. Usually, you will see the reluctant clients either come as visitor or complainants.
Okay.
Any other question? Yes, Pyali, you have mentioned it in chat box. Let me just check. Ma'am, in the case of scaling question for couple counseling, what if one partner feels that there's lack of communication is enough communication when they are rating themselves? Okay, so you want to say what if one client says the communication is 9 and another says it's 4? Is it something you are trying to ask?
No, ma'am. I just want to ask that the person who has this problem with this communication thing, what if they think that like they are not at fault only? Like the person who is rating themselves as 9, what if they are the one who is communicating in a poor way, but they think that whatever they are communicating is the best way they can do it?
Okay. So you can, so there's no problem in that. So that is basically a social skill training that is required. Now, when you start with the scaling technique to goal formation, you have to help the client to operationalize it also. So, for example, I give you this example. This is something the 9 and 4 wala has happened with me when there was a couple came for the counseling, and the problem was communication. One of the problem was communication. So one client say, okay, I feel the communication is proper. It's 9 and then I don't have any problem. But the other say, no, I don't feel any communication is happening. So the definition of communication for both the partners was very different. And when you are when your client is rating the level, you do not put your perception. Okay, your definition of communication doesn't matter there. What matters is their understanding of communication. So you have to make sure that both of them are on the same page for the meaning, and then you compare their scaling.
Okay, ma'am, got it.
Okay. Any other question? No. All sorted with solution focus approach. Anyone who would like to do a small role play with me, like you can bring your problem, we just apply solution focus approach. You want to make your problem or something. And yes, Anjali, would you?
Yes, we can give it a try.
Sure. Okay. So you can even make up the problem or anything, but there's an echo from your side that is coming. So if you can solve that first.
Okay, how can I solve?
Right. You're using, I don't, you're from one device. Hello. Now
I'm
it's
using
fine.
earphones now. I hope
It's better at least.
it
It's
works.
better. Hmm. Yes. Uh, so shall I start?
Yes, yes, we can start.
So I'm not starting with rapport formation or something. I'm directly coming to the point. Okay.
Okay.
Okay. So Anjali, what brings you here today?
I feel the lack of motivation to do anything. I have just completed my master's
Mm-hmm.
and I feel so lazy to do anything, whether it be job search or anything. I don't know what to do. I feel so like not motivated to do things. I don't know why.
Okay. So when you're coming to these sessions, right, with this problem, I want to understand that let's suppose you come to these sessions and you're regular with these sessions, and let's suppose we are done with all the process that is there. So what do you think the new version of Anjali would be like after these sessions?
Sorry, ma'am, can you repeat?
So after we are done with all the sessions that are there, okay,
Hmm.
once we are done with the complete process, what do you think the new Anjali after the sessions, new Anjali who would be there after all the counseling and everything, would be different from you? How that Anjali and this Anjali would be different?
I might feel motivated
You
to
might feel
do
motivated. Okay.
things which I'm not doing now, which I'm supposed to.
Okay.
Yes.
Anything else?
Might be this.
Okay. And what would be the things that would make you feel that you are motivated now?
I don't know that.
Okay. So let's suppose if you are talking to your parents, okay, and your parents come to you and say, Anjali, now you're feeling, you seems to be more motivated towards your goal. What do you think they would have observed in you, or what difference they might have observed in you because of which they are saying you that yes, you are motivated?
My responsibility towards my work that I'm taking up.
Okay. Okay. Anything else? No. Okay. So basically, can I say that when they will see you more responsible, they will feel that you are motivated?
Hmm.
And will that make you also feel that you are motivated?
Yes.
Okay.
But that starting is not happening.
That starting is not happening. So have you thought over, or have you given a thought thinking over this, that uh, what is the first step that is required to start your job search or anything for which you are feeling unmotivated or not motivated?
Yes, I have thought about it, but I feel so lazy to give it a start that I keep postponing it every day.
Okay, that's okay. I think there are many fears that might, stop us from doing it. Uh, so, okay, what is the first step?
First step would be revising all the theories and everything so that I can be confident.
Revising all the theories.
Techniques, basically, counseling techniques, whatever is taught in masters.
How revising the theories would help you to get a job?
Might be in the interviews, like all the interviews are different, so I should know at least the basic details of the techniques and theories so that I can be confident.
Okay. Do you think that revising the topic will be first step to get a job or clear the interview?
Matlab, it's like taking an initiative, something or the other. so that I stay motivated and be consistent and I'm focused to get what I want.
Okay, so according to you, revising the first thing is, and what
Yeah,
is stopping you from doing that?
procrastination.
Okay, and in what form that procrastination is overpowering?
Social media, TV, just sitting here and there ideally, that's all.
Okay, let's suppose you planned a day, okay, where you felt that okay, from this time to this time, I would be reading the topics which I want to for my interview. Okay,
Hmm.
uh, and you start by chance, you start with all the motivation. What do you think would be one thing or the first thing that would stop you from continuing that behavior?
Like not reading or not showing up for reading.
No, you have started reading. Okay, you have
Okay.
started the reading. But what is the first thing that you feel might stop you or might become a hurdle?
I might think that chalo, I'll do it later. That's enough for now.
Okay.
That only.
And what would trigger that thought?
Any form of distraction it could be.
Mm-hmm. Any form of distraction.
Yeah.
Okay. So why not we start working with overcoming the distractions that you get around? Because when you're saying that even because of social media and all thing, I just get up from my place, sit on the next place, I just use my time here and when, and I do not start. That means they are also distracting you from your major goal. Am I correct?
Yeah.
Right? So why not let's start with overcoming these distractions rather than directly going into the lack of motivation? What do you think about this?
This makes sense actually.
Mhm. Okay. And have you made a list of all the distractors you have around you?
No, no, I haven't.
Okay. So let's do one thing. Uh, in the next session, first of all, you first make a list of all the distractions you have, and then we will see what can be done about
Hmm.
it. Okay. Okay. Thank you, Anjali. Uh, okay. First of all, what all solution focus techniques you saw in this?
Me.
Hmm. As a client,
Um, as a client, it was miracle question was there
hmm,
and exception.
exception identities, no.
So I can think of only miracle.
Okay. Others, anyone else who would like to give a try? Okay. So when I asked her that, okay, how Anjali after the sessions would be different from the present one, that is where I was trying to make goal. And that is the form of miracle question that we use. Then when I asked you that what is the first step that is stopping you, I was trying to break down the bigger motivation, which was not very um, uh, for according to me was not a problem, because she said that she is having problem in applying to the job, but reading the material nowhere would help her to get a job. The first step would be maybe making your resume or applying for the job, right? Matlab, just see your contrary, when you will get an interview call you will be motivated to study, but without anything to achieve you won't even study. So that is why the reason I asked you to, ask what distracts you first. Yes, Donovan.
Ma'am, so
Hmm.
in your point of view, you had an idea for what would be the first steps, right? But during the whole time, you did not mention it at all. Is there any particular reason?
Yes, because in the first session I cannot say कि ऐसा नहीं होता है, ये ऐसा होता है.
Okay. So it would be something that you would mention later on if the
Yes. So
client is
what
not
I will
picking up.
do, I have asked her to work on distraction. Now, working on distraction also won't help her to get any job because she is not applying at the first place. Slowly and gradually, when she will say it is not helping me, then I will say, do you think something else would be better option to make you start applying for the job?
Okay. Okay.
I cannot impose my thing, but I know that starting reading is nowhere a first step for get a job.
So it's more like guiding and making them trial and error until they step onto the right path.
Yes.
Okay.
Because if I will tell them, that would become more of guidance rather than counseling.
Understood.
Okay. Okay. So I think I will end the session. I would like you all to please keep your camera on because before I end, I just want to take a group picture.